What would you do if you or a loved one suddenly showed signs of a stroke? Those first few minutes are absolutely critical, and what you do while waiting for the ambulance can make a life-changing difference. A stroke is always a medical emergency, and while nothing you do at home can stop it, knowing the right steps can protect the brain and significantly improve the chances of a better recovery. Today, we're going to walk you through the essential, doctor-recommended actions to take the moment you suspect a stroke. This information could help save a life or prevent long-term disability. But first, a very important disclaimer. This video is for educational purposes only and does not replace professional medical advice. If you see any sign of a stroke, your very first action must be to call for emergency help immediately. Every second counts. So, why is time so critical when it comes to a stroke? A stroke happens when blood flow to the brain is cut off, either by a clot, which is an ischemic stroke, or by a burst blood vessel, a hemorrhagic stroke. In either case, brain cells begin to die within minutes due to a lack of oxygen. The longer the brain goes without blood flow, the more severe the damage can be. This can affect speech, memory, movement, and more. The phrase "time is brain" is something every neurologist and a doctor lives by. Quick action not only saves brain tissue but also opens up more treatment options. For example, a clot-busting drug called TPA can only be given within a very narrow window, typically a few hours from the start of symptoms. The sooner you get to the hospital, the more tools doctors have to help. That's why your response before the paramedics arrive is the first and most vital link in the chain of survival. Now, let's talk about the warning signs. The easiest way to remember them is with the acronym FAST. F is for face. Ask the person to smile. Does one side of their face droop? A is for arms. Ask them to raise both arms. Does one arm drift downward? S is for speech. Ask them to repeat a simple sentence, like "the sky is blue." Is their speech slurred, strange, or are they unable to speak at all? And T is for time to call for help. If you see any of these signs, even if they seem to go away, it's time to call emergency services right away. But there are other, more subtle signs that seniors and their families sometimes miss. It could also be sudden trouble seeing in one or both eyes, sudden dizziness, or a loss of balance and coordination that makes it difficult to walk, and sometimes it presents as sudden confusion or trouble understanding things. The key word here is sudden. These symptoms appear out of nowhere. Don't brush them off as just a senior moment or feeling unwell. It's always better to be safe than sorry. Remember, a stroke doesn't always look dramatic. It can be quiet and confusing, which is why knowing all the signs is so important. Okay, you've recognized the signs and you've called for help. The dispatcher is on the line and the ambulance is on its way. What do you do in these next few crucial minutes? First, stay on the phone with the emergency dispatcher. They will guide you through what to do and can provide life-saving instructions. Do not hang up until they tell you to. Next, note the time when the first symptoms appeared. This is one of the most important pieces of information you can give the medical team. It helps them determine the best course of treatment. If you can, write it down so you don't forget in the stress of the moment. Now, let's talk about positioning. The person should not be walking around. Help them get into a safe and comfortable position. The best position is lying down with their head and shoulders slightly elevated, supported by a pillow. This is called the recovery position, especially if they are unconscious or drowsy. To do this, gently roll them onto their side. This helps keep their airway open and prevents them from choking if they happen to vomit. Don't let them lie flat on their back, as this can be dangerous. Loosen any tight clothing around their neck, like a tie, a scarf, or a tight collar, to make breathing easier. The goal is to keep them as stable, safe, and comfortable as possible until help arrives. And remember, keep them warm with a blanket if needed. Just as important as knowing what to do is knowing what not to do. These are dangerous mistakes that can make the situation much worse. First and foremost, do not give the person anything to eat or drink, not even water, and especially not any medication like aspirin. You might think aspirin is a good idea because it's a blood thinner, but you don't know what kind of stroke is happening. If it's a bleeding stroke, aspirin could be fatal. Giving them food or water could also cause them to choke, especially if their ability to swallow has been affected. Another major mistake is trying to drive them to the hospital yourself. It might seem faster, but it's incredibly dangerous. First, their condition could get worse on the way. What if they lose consciousness or have a seizure? you can't help them while you're driving. Paramedics, on the other hand, can begin life-saving treatment the moment they arrive. Calling an ambulance is always the safest and fastest way to get the right care. Lastly, don't dismiss the symptoms, even if they disappear. A mini-stroke or a TIA can have symptoms that resolve quickly, but it's a major warning sign that a full-blown stroke could be imminent. Always treat it as an emergency. If you're a caregiver or a family member, your role is absolutely vital. The most important thing you can do is stay calm. Your calm presence can help keep the person calm, which can help regulate their heart rate and blood pressure. Speak in a clear, reassuring voice. Let them know that help is on the way and that you are there with them. When you call for help, be ready to provide clear information. Tell the dispatcher you suspect a stroke. Give them your exact address and location. Tell them the person's age and the specific symptoms you're seeing. And most importantly, tell them the time the symptoms started. While you wait, gather some essential items if you can do so quickly, without leaving the person alone. This includes their ID, a list of their medications, any known allergies, and contact information for their doctor or family members. Having this ready for the paramedics will save precious time. When the emergency team arrives, let them take over. Clearly and concisely tell them what happened, what you observed, and give them the information you gathered. Your clear communication helps them do their job more effectively. Finally, let's talk about how you can prepare for an emergency like this in advance. Preparation can make all the difference in a high-stress situation. First, make sure the fast signs of a stroke are posted somewhere visible in the home, like on the refrigerator. Everyone in the household, including visiting family and friends, should be familiar with them. Next, prepare an emergency information sheet. This should include the person's full name, date of birth, a complete list of medications they take, including dosages, any allergies, their primary doctor's name and phone number, and any major medical conditions. Keep this in a clear, accessible place, like in a folder by the front door or on the fridge, so you can grab it quickly. Also, program emergency contacts into their phone and your own under ice, for in case of emergency. Make sure your house number is clearly visible from the street, both during the day and at night, so that paramedics can find you without any delay. If you live in an apartment building or gated community, make sure you know how to give emergency responders quick access. Taking these simple steps now can save you from panic and confusion during a real emergency and ensure that your loved one gets the fastest, most effective care possible. Knowing these steps is an incredible act of love and responsibility for the seniors in your life. By understanding the signs, acting fast, and knowing what to do while waiting for help, you can be a true hero in a moment of crisis. Thank you so much for watching and for taking the time to learn this vital information. If you found this video helpful, please give it a thumbs up to help spread this knowledge to others. And don't forget to subscribe for more essential health tips for seniors. Share this video with your family and friends, it might just save a life. Stay safe, and we'll see you in the next video.